I still hear some skepticism on two fronts. One is PPE really necessary for community health workers? I think we have provided ample evidence on this call that PPE is necessary for CHWs to fulfill their full promise. And then the second question we sometimes get is, will COVID really play out in Africa? Will the numbers spike in the way that we all are worried about? And I think if you continue to look at the way that it has played out in certain parts of the continent, whether it's South Africa or Ethiopia, we can see where numbers have gone up. And I would just advise you to keep looking at the evidence from Africa CDC, or even our friends at Resolve to Save Lives, who are tracking this across the continent carefully. And I continue to be convinced that we're going to be dealing with this epidemic for the next 3 or more years in our context, because getting to a vaccine is one thing, getting equitable distribution of a vaccine is another. So COVID is the new context. We're going to need to address this in all of our sites, both as organizations and our Ministry of Health partners, to make sure that health workers are fully protected. Because as we move from the early epidemic, as it moves out to rural and remote communities, the response will depend more and more on community health workers. As we move from testing to treatment options to the vaccination options, we're going to need PPE throughout all of that, and vaccinations aren't going to be covering the entire population at once. So we're going to need PPE for the long run here. And I think that it's probably just a false comparison to say, should we put our resources into the US response or the African response? I think with a health equity perspective, I would say that these communities have been disproportionately affected by the global marketplace that's been described here, a fragmented marketplace, a marketplace that's favored those who already have access to power and privilege and can control the manufacturing and distribution of PPE. So if this effort here can do anything to disrupt that power and do our best to distribute PPE to those communities and those places which are most vulnerable, and actually have the least access to the support services in facilities that would be necessary, like the ability to intubate and provide oxygen when needed. I think that that's a worthwhile investment, and that's the value proposition I see here.